Good morning and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today, again, is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. We're starting to see some improvement in our local case numbers, and the actions we've been taking as individuals and as a community are making an impact. Over the past 2 weeks, cases have dropped nearly 40%. We've reached our peak and cases are now coming down. This is the beginning of what we hope is a trend in the right direction. We need to continue our current efforts to help preserve access to our hospitals and healthcare, keep schools open, and reduce disruption in business services. Let me tell you about our local situation. Let's take a look at our local data and see what it's telling us. As I mentioned earlier, we can clearly see that the number of new cases peaked the week ending January 15th at 4,963. We then saw a slight decrease to 4,754 the following week, and then a more pronounced drop to 3,042 this past week, ending Saturday, January 29th. This was a drop of over 1,900 cases, or close to a 40% decline. We are cautiously optimistic. Another week's worth of data will be very important to show a continued decline. We also saw a decrease in our local positivity rate, which dropped from 30.7% the previous week down to 25% this past week, ending January 29th. This is still very high, but again, we hope this is the start of a trend in the right direction. An area where we aren't seeing improvement yet is COVID-19 hospitalizations. The number of COVID-19 patients hospitalized continues to be very high. At the end of last week, we remained at a weekly average of about 134 patients. Yesterday, however, the hospitals reported 147 patients with COVID. That included 113 Lancaster County residents, and this is the highest number of individuals from our community since the pandemic began. Today, the hospital numbers are reporting 138 COVID-19 patients, with 104 from Lancaster County. We've heard directly from hospital administrators and from a variety of frontline staff caring for those who have become severely ill with COVID. What is different now than the previous highs of COVID-19 hospitalizations is that the most recent increase in patients has remained elevated for a very long time. This has put continuous and considerable strain on both the hospital capacity and the staff. The differences reflected on this chart shows hospitalizations over the span of the pandemic. The high peak you see on the left side is from November and December of 2020, prior to vaccine being available. This was a relatively quick increase and a quick decrease. However, on the right side where we are today, you can see the sustained high level of hospitalized patients beginning back in September of 2021 through today. To help ease this situation, the Nebraska Department of Health and Human Services yesterday opened the first site of its hospital decompression program here in Lincoln. The program will help relieve some pressure on local hospitals by providing a facility for patients who no longer require acute care, but still required skilled nursing care and have been unable to relocate to a skilled nursing facility. The Lincoln site will have between 16 and 36 beds operated by Mission Health Communities, and they've started taking these patients, as we said. With the sustained high level of ill patients, we've also experienced an increase of COVID-19 deaths over the past 2 months. 26 deaths were reported in December of 2021, and 37 were reported in January of this year, the highest monthly total since January of 2021. Due to the high number of recent cases and hospitalizations, we are likely to see more deaths reported in the coming weeks. And today, sadly, we are reporting the death of a man in his 90s. and this is the second death so far in February. While some of the indicators are showing improvement, most are still very high, so the risk dial will remain in red this week. Even though our cases have peaked, this doesn't mean the threat is over. The risk of infection is still very high, and we will still continue to see the consequences of so many cases in a short period of time, primarily in our additional hospitalizations and deaths. We cannot let our guard down yet. We still need to help our hospitals and schools get through this surge. And here's how we can continue to do that. Stay home except to go to work or school, to buy food or get medical care, or to get tested or vaccinated. Mask up indoors. Get vaccinated or boosted now, and avoid crowded situations, and don't attend big events like concerts or athletic events. And get tested if you have COVID-19 symptoms or have been exposed to someone who has the virus. And if you're sick, please stay home and away from others. Vaccines remain our most powerful tool in preventing severe illness and saving lives. And they are critical in getting COVID-19 to a level that is more manageable and less disruptive to our daily lives, our schools, our businesses, and our hospitals. A booster dose provides the best protection against highly transmittable variants such as Omicron. Studies clearly show that the protection against severe illness and hospitalization is highest for those who are boosted when they're eligible. And more than 59% of residents aged 12 and up who are eligible have received that booster or third dose here in our community, and that number continues to rise. However, that also means there are around 40% who have not. And booster doses make a difference in protecting against Omicron. We continue to reach out to residents with a reminder when it's time for their booster. If you're due for that booster dose, please get it now. Another 30% of children aged 5 through 11 are fully vaccinated, and more than 65% of all Lancaster County residents are fully vaccinated. And I also want to mention today that Moderna's COVID-19 vaccine received full approval from the Food and Drug Administration on Monday, reinforcing the fact that the COVID-19 vaccines are safe and effective in providing people some additional peace of mind as they roll up their sleeves. And yesterday afternoon, Pfizer asked the Food and Drug Administration for emergency use authorization of the COVID-19 vaccine for children 6 months through 4 years of age. If the FDA does authorize the vaccine for this age group, then the Centers for Disease Control and Prevention would make the final decision. We'll be monitoring this situation very closely and reporting to you if there are changes. This weekend, we have 2 walk-in vaccination clinics at Color Middle School. Saturday's clinic is from 9 a.m. to 3 p.m., and Sunday's clinic is from 9 a.m. to noon. And we have clinics at the health department today, including a late afternoon evening clinic from 4 to 7, as well as clinics on Thursday and Friday. You can also schedule an appointment if you prefer, and you'll find more clinic times and locations at covid19.lincoln.ne.gov or by calling us at 402-441-4200. All clinics offer first and second doses for 5 and up, Pfizer booster doses for 12 and older, and Moderna booster doses for 18 and older. In addition to vaccination and boosting, masking is part of the strategy to slow the spread of the Omicron variant. The federal government recently launched an N95 mask initiative nationwide that you may have heard of. Masks have been shipped to local pharmacies and community health centers. Everyone can get up to 3 free masks. The pharmacies distributing the N95 masks include chains like Walgreens, CVS, Hy-Vee, Walmart, and Costco, as well as some locally owned pharmacies. Contact your local pharmacy first to find out if their shipments have arrived. At our last briefing, we mentioned a new at-home testing initiative from the Nebraska Department of Health and Human Services, and we have more information to share today. We anticipate we'll get around 30,000 test kits for our community. We are awaiting some additional information from the state, and as soon as we receive it and have kits in hand, we'll provide more detail on distribution. Also, every household in the U.S. is eligible to receive 4 free at-home COVID-19 tests from the federal government. The website where you can order these tests is covidtests.gov. The Health Department Total Wellness COVID-19 and Total Wellness testing site at 1918 O Street is another testing option available. Testing is by appointment only, and you can get an appointment the same day. Just go to totalwellness.com/Lincoln to schedule. Other testing options are available at our website. Whether you're getting tested at a testing site or taking a self-test at home, if you do test positive for COVID-19, you need to stay home and isolate. If you're exposed to someone who has COVID-19, you may need to quarantine. Isolation and quarantine resources are posted on our website at covid19.lincoln.ne.gov, along with other valuable information and guidance. The improvement in case numbers and positivity rate is welcome news and shows how we conduct our daily lives and actions we take can make a difference in the number of cases, hospitalizations, and deaths occurring in our community. It's too early to tell if this drop will continue, and we certainly hope so. We need to be careful as we see some of our numbers start to come down and stay focused on our prevention methods, including getting vaccinated, getting your booster dose, and masking up. And with that, I'd be happy to take any questions.
For the N95 and KN95 masks, can they be reused? And if so, how many times?
You know, we have those directions. It depends what they are, but we have those directions on our website. So I would encourage people to go there. And hopefully, I haven't received any of them personally, but I'm hoping that there would be a set of instructions for users as well.
Hi, Pat, it's Matt Olberding from the Journal-Star. Hi, I had a couple quick questions for you. Do you happen to know, are the patients, there's a lot of talk about how Omicron causes milder cases, especially if you've been vaccinated. Do you happen to know if hospital patients that are in the hospital now, if they're less sick, staying less time, less likely to wind up in intensive care on a ventilator?
Matt, it's very variable, but we are seeing that with the Omicron, people are being discharged somewhat sooner, and their symptoms are a bit different than with the Delta, for sure.
And then in terms of the long-term care beds or the skilled nursing care beds that have been opened up for hospital patients, those ones in Lincoln, are they taking patients from the area, from Lincoln hospitals, or are they taking patients from all over, just where the need is greatest?
We have asked and worked on that to make sure that we can address our local needs and remove that strain on our hospitals here in Lincoln. So it's our understanding that those beds in Lincoln will be for patients hospitalized at one of our hospitals here.
And one more question I had for you. I've heard a lot lately about Nomi Health having a lot of problems getting test results. Are you aware of that, or have you heard anything? I've heard instances of it taking several days. I also heard there was at least one day and possibly more where they made a bunch of errors and people's results either didn't get recorded or got recorded incorrectly, and they had to redo tests.
Matt, we have not been contacted about that here, and actually I was just checking on their testing turnaround time, and they're usually been within 48 hours to 72. Of course, we'd like them to be improved from that. So I will do some more follow-up because that certainly would be a little concerning to me what you're saying right now.
Okay, and then I just have one more quick question for you, because it's a question that I get asked a lot, and you may not have this answer, but I'll ask. Do the hospitals keep track of patients that are currently hospitalized with a positive COVID test, if whether that patient is in there because of COVID, basically because they're sick, or whether it's somebody who tested positive because they were there for a surgery or something else and had to take a test for that and just happened to test positive but were asymptomatic?
That's something that's being asked a lot everywhere, and that is something we've talked to our hospitals about and looking at. And anybody that's kind of secondary identified as having COVID is very, very rare here. Generally, the people that are hospitalized are admitted. The reason they're there is because they're ill. They might be they might be clinically diagnosed and pending their test result back. But in general, the people hospitalized in our hospitals are there because they've been diagnosed with COVID as a primary diagnosis.
Okay, great. Thank you.
Yeah. Is that all? Okay. All right. Thank you again for joining us today. And remember to get vaccinated and get your booster and wear a mask. Thank you.